Thank you. Hello, everyone. My name's Amr. I'm an internal medicine trainee here in the United Kingdom. I wanted to highlight this case because although schistosomiasis is not an uncommon disease, I found that in the Western hemisphere, people tend to think of it a lot less. And with the rising movements of people across the planet, I think it's an important one to highlight. Um, so this patient was a 15-year-old child. Um, he had been complaining for 6 months of intermittent hematuria and almost a year of rectal bleeding. Um, Had a past history of pulmonary tuberculosis and chickenpox. Um, as I said earlier, this man was an asylum seeker. He had come from Eritrea, and he had a long journey. He really traveled across a lot of countries. He essentially walked the entire way. Um, Examination-wise, when I saw him, there wasn't anything out of the ordinary. There was no blood on a rectal exam. There was no visible hematuria. His blood investigations were generally unremarkable. We had sent urine and stool cultures, stool PCR tests for a few of the common pathogens. But again, that highlights the different focus in different countries where we really needed to be thinking about where this young man had come from and the journey he had taken. Um, An ultrasound test was done to assess his bladder, and we could see a few areas of focal thickenings. These are representative images and not actual images of the patient. These areas had was somewhat typical for schistosomiasis, which is a lot of blood flow. Another diagnostic test was done, which is a diagnostic cystoscopy. In patients of this age, we tend to do it under general anesthesia, although normally it's done under just local anesthetic. It did show what, again, another typical finding, what we call sandy patches in the bladder, but nothing else. Uromicroscopy was finally diagnostic of schistosoma hematobium. You could see the ova. And he was treated with praziquantel and had a full recovery, thankfully. Bit of discussion. Yeah, schistosomiasis is a parasitic disease. It's caused by a trematode. Schistosoma hematobium is the most common one. Is the one that causes most of the cases of urogenital schistosomiasis. Most of the time it causes just hematuria. It is endemic in Africa, including Eritrea, which is the patient's country. His journey through multiple areas along the Nile, where it's also endemic, probably is where he picked it up. It's mostly in tropical and subtropical areas, areas without access to safe drinking water, areas where people tend to swim in rivers that might be infected. It's estimated that 90% of people who require treatment for schistosomiasis are in Africa, but a lot of these people are now coming over to Europe, going to the US, and we need to be aware of this pathology. There's a few other forms of schistosomiasis, mainly affecting the intestinal and digestive system. The presentation. As this case is particularly about urogenital schistosomiasis, hematuria and rectal bleeding are the most indicative of this pathogen. The intermittent natures suggest a chronic timeline, long-standing infection. It is extremely uncommon in the UK. There's only a handful of cases that I could find in this place. The diagnosis is not that difficult, but what is important is that we think about it and we think about where the patient is coming from. Treatment, thankfully, there's not a lot of resistance, and praziquantel remains very active and has very high curative rate. As I've said throughout the case, my aim is to just not only highlight schistosomiasis, but also get people thinking about where our patient has come from, where they've been, the importance of thinking about the local microenvironment, and what pathogens they may be carrying. And that's it. Thank you very much. I'm open to any questions if anyone.